Hi guys, we are here to discuss the part 1 of apoptosis, and the overview is the definition, physiological and pathological causes, and the morphological changes. By definition, apoptosis is a type of cell death which is tightly regulated and is a suicidal type of cell death in which cells which are destined to die activate certain types of intrinsic enzymes that degrade the cellular DNA and also the nuclear and cytoplasmic proteins. And here the plasma membrane remains intact, and also apoptosis doesn't elicit an inflammatory response. Then we have the physiological causes. Death by apoptosis is a normal phenomena that serves to eliminate cells that are no longer needed or as a mechanism to maintain constant number of cell population. Also, cells undergo apoptosis as they are deprived of necessary survival signals, such as when they are deprived of growth factors or when they receive pro-apoptotic signals from the surrounding environment. Examples are the removal of supernumerary cells during development and the maturation of the tissues, and also seen in the hormone-dependent tissues. On hormone withdrawal, such as endometrial degradation in the menstruation, and also the follicular atresia during menopause, regression of the lactating breast, and also seen in the epithelial cells in the intestinal crepes to maintain a constant cell numbers, elimination of immature lymphocytes that fail to produce functional antigen receptors, and also elimination of self-reactive lymphocytes to prevent autoimmune disorders, thereby acting as a protection for the body. And the cells that have served the purpose, for example, the neutrophils in acute inflammatory response and lymphocytes at the end of immune response. Then we have the pathological causes. Pathological causes: DNA damage, radiation, and the cytotoxic anti-cancer drugs, production of free radicals that activate the intrinsic mechanism, which is the mitochondrial mechanism, which we'll discuss in the part 2, and thus by serving as a protective mechanism. And also when there is an accumulation of misfolded proteins, and also the apoptosis is induced during certain infections, particularly viral infections, due to virus itself, such as adenovirus in the HIV, or due to host immune response and viral hepatitis. And an important point is apoptosis may also cause to pathological atrophy in the parenchymal organs after duct obstruction. Then we have the morphological or biochemical changes. First, we have something called as cell shrinkage, in which the size of the cell is reduced and the cytoplasm becomes dense and eosinophilic, and the organelles are normal but tightly packed as seen in the figure. And the second morphological change is chromatin condensation, which is the most characteristic feature of the apoptosis, in which the chromatin aggregates and it is seen at the periphery under the nuclear membrane, and also the fragmentation is seen in some cases. And the third is the formation of the cytoplasmic blebs and apoptotic bodies. In the figure we can see the culture of the cells undergoing apoptosis, showing blebbing and formation of apoptotic bodies. In the figure B, showing the nuclear fragmentation, and the figure 3, which is showing the activation of caspase, which will be discussed in the part 2. Thank you.